Good evening, everybody. So we're going to talk today about an interesting topic, which is an unfortunate event. It actually has afflicted many famous people. The condition is called glioblastoma. It's a type of brain tumor which is very aggressive. There are essentially two types of brain tumors. One is benign and the other is malignant. In the benign category, you get tumors that are in the top of the brain, outside the brain, and in the back of the brain. For the most part, they have very good outcomes with treatment. Most of the time, the treatment is surgery. Sometimes it can be treated with radiation. The cancerous brain tumors are of several types. The worst type to get is something called glioblastoma or glioblastoma multiforme. Everybody has probably heard about it now in the news because our Senator John McCain from Arizona has been diagnosed with that about 2 years ago, and unfortunately, it is a terminal illness. Lifespans with treatment can be expected to be between 1.5 to 2 years. Without treatment, it's much less. There are some rare conditions with the rarer types of treatments where glioblastoma patients have lived for many years. And I'll go through a bit with regards to the treatment of glioblastoma. Glioblastoma is treated in two broad categories. One is surgical to take out the tumor, and two is with chemotherapy, radiation, and immunotherapy. The traditional chemotherapy and radiation tends to give people about 1.5 years worth of lifespan, sometimes 2 years. The immunotherapy treatments, which are given in some specialized centers, and some of the immunotherapy treatments are given in a place like Sloan Kettering Hospital in Manhattan, and then at the Duke University Neuroscience Center, where they actually introduce a type of virus that kills the cells, and lifespans can be 5 years and up. There has been some rare cases where young people who develop glioblastoma have lived for almost a decade or more with that types of immunotherapy treatments. The patients who have had glioblastoma are can be of various demographics. The most common age groups are 40-year-olds and up. Sometimes even when they're 60 or 70, it can occur, like in Senator McCain. Glioblastoma, when it's treated with the chemotherapy radiation, has many side effects, such as nausea, vomiting, weight loss, and loss of appetite. We try to treat these side effects with medications. We have been able to treat some of those side effects in New York State with the use of medical marijuana. Medical marijuana or medical cannabis oil does treat loss of appetite, does treat weight loss, and does treat symptoms where the patients are very tired and apathetic. So that's basically a brief overview of brain tumors, both benign and malignant. The easiest way to diagnose one is with an MRI of the brain, or a CAT scan of the brain may be required also. And once you diagnose it, if it's a benign tumor and if it's small enough, you can follow it along. For the most part, they don't need surgical treatment. They can be monitored if it's small enough with an MRI once a year. If, of course, it grows, then it needs to be removed surgically. If it's a malignant tumor, it will need to be treated aggressively with chemotherapy and radiation and surgery. Even with all of that, it is going to be very difficult to treat it because these are malignant and lifespans don't change too much unless you're one of the lucky few who respond well to the newer immunotherapy agents. With that, I will hand over the mic to some of the questions on the audience. This will be a short session today.
How often does brain cancer lead to seizures or an equivalent condition?
So the question is, how often does brain tumors and brain cancers lead to seizures and equivalent conditions? Many brain tumors present with seizures as their first symptom. Because it's an irritant to the brain, it can cause short-circuiting of the brain, and ultimately that causes a seizure, and patients end up having an MRI of the brain or a CAT scan of the brain that diagnoses a tumor. The incidence of seizures as the presenting diagnosis, that's the presenting symptom, is in the high teens, in the 15 to 19% range. But the incidence of patients who have seizures from brain tumors is very high. It's in the 80 to 90% of patients with brain tumors do have seizures, especially the malignant tumors. The benign tumors, it's very low.
Is there an average age of diagnosis?
The average age of diagnosis of a malignant brain tumor like glioblastoma is in the 40s to 50s.
If glioblastoma is a fatal diagnosis, is treatment even necessary, being it typically decreases quality of life?
Well, that's a wonderful question. Whether or not do we treat a patient with glioblastoma to improve quality of life? If it's a very big tumor, very bad location in the brain, then surgery is not is good. Chemotherapy, radiation is all right to reduce the size. It buys the patient about 12 to 14 months worth of lifespan, for the most part. Sometimes you're lucky enough you can get 2 years. Without that, you're pretty much given a prognosis of 6 months or less without that kind of treatment. So it really is very personal a decision. If patients need to plan their future, plan their lives, and they need a year and a half to plan all of that, it's worthwhile approach to get chemotherapy and radiation. If for some reason you're an older person in their 80s and 90s and you've planned everything out and you've lived your life normally and you don't want to go through the torture of chemotherapy, radiation therapy, then there's no reason to go through all of that treatment.
Is surgery effective in treating glioblastoma?
Surgery is not a cure. It's only to reduce the size of the tumor so that the chemotherapy and radiation therapy that's given will work on the smaller residual tumor cells more effectively and buy extra time. Instead of having a 1.5 year lifespan, it can give you 2 to 3 years worth of lifespan.
Medical marijuana has neuroprotective effects. In large doses, can it theoretically slow growth of brain cancer?
Well, that's a hypothetical question where medical marijuana can potentially slow the growth of brain cancers. It is not practically possible because we're not even sure what the dose is for that. But what we use medical marijuana for in the settings of glioblastoma is utilize it for treating the nausea associated with the chemotherapy, the lack of appetite associated with the chemotherapy, the tingling and numbness that people feel from the radiation therapy, because radiation therapy can cause neuropathy. And those are the main reasons why we use medical marijuana.
Are family physicians qualified to diagnose cancer?
Well, many times what we find in patients with brain tumors that are malignant, patients will go to their family physician with symptoms of a seizure that they've had or some horrible headaches, and they may do a brain MRI because they may want to expedite matters. At that time, they would have diagnosed a brain tumor, but they would not have known what is the type of tumor. That needs to be diagnosed more specifically and risk stratified by a specialist. Once that is stratified, and then we can embark on a treatment. Usually that type of stratification is done by neurologists and neuro-oncologists.
Is there a higher risk for any form of brain cancer if there's a family history of it?
There's not a higher risk of any form of brain cancer. There's a higher risk of some brain cancers with the genetic history, and those are rare, and they're usually brain tumors that affect in the back of the brain, and they're called gliomas of the brainstem, and they're very rare, and they don't occur too often, and cures can occur very commonly with those types of benign brain tumors of the brainstem.
Do certain occupations lead to a higher risk of cancer?
Patients who have exposure to high risks of radiation, electromagnetic radiation, tend to have increased risk of all types of cancer, including brain cancer.
How does the scaling of brain cancer work? Grade 1, grade 2, etc.
Basically, it works based on size. It's based on the size and where it has grown into. If it's less than, most tumors, if they're less than 1 centimeter in size, they're low grade. If it's as long as it's not a glioblastoma, if it's a glioblastoma, it automatically becomes a grade 3. And if it's a glioblastoma which is beyond 1 centimeter and has actually got satellite lesions, then it's a grade 4. So the grading of brain tumors that are malignant is for the most part based on size, and glioblastoma specifically is also has an add-on feature of having satellite lesions. These lesions that are nearby the core lesion but are not attached to the core lesion.
Is any hospital or clinic able to adequately treat brain cancer, or only specialty hospitals like Sloan, as mentioned?
Yes, if I was in New York City, I would pursue brain tumor treatments at brain cancer treatments at Sloan. If it's a benign tumor, it can be treated anywhere. Most of the time, if it's a small benign tumor, you don't need to do anything. You just follow it along once a year with an MRI, and 9 times out of 10, nothing happens. If it's a malignant tumor, I would suggest going to an oncology center like Sloan. Other hospitals do have good oncology centers also in the city, and every big city like Boston, Philadelphia, Washington does have the same.
Does cancer treatment cost a lot of out-of-pocket money, or is it covered by insurance?
So that's a great question about insurance coverage. If you're a member of one of the affordable health care plans, that is through the Obamacare, for the most part, cancer treatment is covered 100%. The worst thing that could happen to you is that you would have a deductible. The deductibles could be up to $5,000. So that means you have to have the first $5,000 of treatment to be covered. After that, everything else is covered by your health insurance.
What is gamma knife therapy?
So gamma knife therapy is a type of treatment which is localized radiation. It's like a laser beam of radiation that is given right to the tumor. It shrinks the tumor, and it's given to certain types of tumors. Most of the tumors that it's given to are benign tumors that are in very awkward locations. Sometimes the tumor is benign in the brain, but it's located in a very unusual area, like around the nerve of the eye, sometimes around the nerve of the ear, so your hearing is affected, or sometimes around the nerve of the face where your facial pain is affected. So that it's easier not to do full-blown surgery because you may sacrifice that nerve. Here you just laser beam that nerve from the outside to reduce the size of the tumor, and that way you're basically able to cure the underlying symptoms of pain, headaches, dizziness, etc., and also minimize the size of the tumor so it doesn't grow in any way.
Does any form of brain cancer typically spread rapidly to other organs?
The most common brain cancer that has the ability to spread to other organs is glioblastoma multiforme, where it has seeding of the tumor into other areas of the spine. Most of the time we get brain cancer when we find a tumor in the brain. The vast majority of the time it's not a tumor of the brain, but it's actually a tumor from somewhere else. And the common reason we find tumors in the brain is actually a tumor from the lungs, and it's very common in patients who are smokers, long-term smokers, or in women who have breast cancer that has moved to the brain. Those are the two common ones. There are rare ones where you have cancer cells that have traveled from your skin called melanomas, and those tumors travel to the brain. Unfortunately, those are also very metastatic tumors, and they're very rare. But when they do travel to the brain, they're catastrophic because they bleed inside the tumor. The other type of tumor that bleeds inside the tumor when it travels to the brain is a tumor from the thyroid gland called the thyroid follicular cancer. And those are also rare, not too common, but it bleeds inside the tumor in the brain. So that when one diagnoses a tumor inside the brain, if it turns out to be a malignant tumor and doesn't look like a glioblastoma or something like that, then it is really important for the patient and the doctor treating the patient to look elsewhere, such as in the lungs, in the chest cavity, and the thyroid gland.
Are all forms of brain cancer a fatal diagnosis, or can patients live the majority of their lives in some cases?
There are some low-grade brain cancers that people can live normal lives with. It just requires the luck of having this tumor located in in a location that is not serious, and also it must be very small in size.
What would be a location that is less serious in terms of brain tumor?
The most common locations that are less serious are in the base of the brain around the temporal lobes, where it's at the tip of the temporal lobe, easy access to be removed, and you can essentially just shave it off the temporal lobes, and then pretty much the tumor is gone.
Do brain tumors often lead to emotional side effects or mood swings?
The brain tumor itself doesn't cause emotional side effects or mood swings. It's the location of where it sits. If it sits in a part of the brain, in the frontal part of the brain, it can cause emotional side effects. If it sits in the temporal lobe of the brain, it can cause mood swings and it can cause seizures easily. So it all depends on where the location is and the size.
What is the efficacy of proton therapy in treating tumors in the brain?
Proton therapy has some efficacy. It's not so great with glioblastomas. A minority of patients, when getting proton therapy with glioblastoma, have found enhanced life expectancies between 10 to 12% increase. It is not a great cure-all, but it does definitely enhance your lifespan if you're afflicted with a type of glioblastoma that cannot be reoperated or cannot be given any further chemotherapy.
When operating on a glioblastoma, is the patient awake, like often seen in movies, or are they asleep?
No, when operating on a glioblastoma, they're in general anesthesia, and they're only awoken if, during the course of surgery, if there's an issue of where the tumor is located, and they're awoken just to make sure that they can move their limb that the tumor is that is controlled by the area around the brain where the tumor is located while the operation is taking place. That's not usual. The most common, mostly they're all asleep.
Are stem cells a form of effective therapy for cancer, or is that not being used at this time?
No, stem cells are not an effective therapy for cancer, but an effective therapy for the complications of removing brain tumors. So when patients have had their brain tumor removed, they usually have complications of paralysis, weakness, etc. Stem cells can be implanted into those spots to reduce the downside effects of the same.
Being cancer is growing in terms of commonality, why is there not a more effective treatment in reducing cancer growth or its spread time?
Yes, I think what we've been able to do over the last 2 decades in medicine is early diagnosis of cancer. With the advent of diagnostic imaging and with the advent of blood tests, we've been able to early diagnose the cancer. So instead of diagnosing the cancer at stage 4, we're able to diagnose the cancer at stage 1 or 2. So the outcomes improve. Unfortunately, if it's a glioblastoma, the outcomes are not good, whether it's a 1 or 2 or a 3 or 4. The outcomes are always very, very poor. That one type of brain tumor is one of the ones that many neuro-oncology labs are looking at various treatment modalities. Right now, the neuro-oncology labs at Sloan Kettering Hospital and at the Duke University neuroscience centers are sort of ahead of the game. They have certain unique immunotherapies for those types of patients that can allow them to live longer. It's not a great quality of life, but it does allow you to live much longer with these immunotherapies if it works. And it does work on a fair share of patients who've enrolled in it. And it's an interesting treatment where the immunotherapy agent actually attacks only the tumor cells in the brain.
How do you feel about people linking technologies such as cell phones to brain cancer?
Yeah, I mean, the famous case with regards to cell phones and technology, cell phones causing brain cancer, was O.J. Simpson's lawyer, Johnny Cochran. Johnny Cochran, who defended O.J. Simpson in his murder trial, and of course O.J. Simpson was acquitted. Johnny Cochran used to use 2 cell phones almost simultaneously and had it around his ear, constantly on either ear, according to his family members. The cell phones give off electromagnetic radiation at about 900 megahertz, and those are equivalent to what you see in a microwave. And unfortunately, it's like keeping your head inside a microwave continuously. So unfortunately, Johnny Cochran developed a brain tumor right behind the back of the head behind his ears, and that brain tumor happened to be a malignant brain tumor, and the family sued Nokia for the same. And if ultimately there was no proof, it was just a belief that it was due to cell phones. Till today, we have no proof, no conclusive proof as to the cause of malignant brain tumors, as if it's related to the use of cell phone use. However, even then, I would not advise you to keep a cell phone to your ear all day long. It may be better off using a headset which has no radioactive or electromagnetic forces.
Do you consider the United States to be a pioneer in regards to cancer research, or are other places such as Germany more innovative?
Well, Germany and Switzerland have become more innovative, that's for sure. But the problem is, along with innovation, there are a lot of false prophets that are propagated through these innovative ideas. Many people claim that they have a cure for a particular type of cancer. What we can guarantee in the United States is that if there is a treatment outcome that is projected, we pretty much can guarantee that in a particular disease state. So if a radiation treatment and a chemotherapy agent is being used for a particular type of tumor in the brain, and we give you a prediction that 70% of your lifespan will improve, we're pretty much on target here. Whereas in these countries like Switzerland and Germany, the regulations are not as much, and people tend to exaggerate their outcomes. Sometimes, not all the time, but truly, if you have a tumor like a glioblastoma, yeah, I would scour the earth for innovative ideas once you've exhausted the customary ideas and treatments such as chemotherapy, radiation therapy, and surgery. So a couple more questions, and then we'll call it a day, guys. And then we can always ask us online, and we'll answer it.
Do people with brain cancer follow up with you, a general neurologist, or would they follow up only with a neuro-oncologist?
So patients with brain tumors are usually diagnosed through our offices. We then send them for neuro-oncology care. Places like Sloan, for instance. Once they have been initiated with treatment and completed their radiation and chemotherapy treatments, they are then usually followed back up at our offices, because there's no active treatment that's going on there. They usually go back to the neuro-oncologist once a year. We'll monitor them on a monthly basis for their medications, side effects, things like that. Many times we prescribe them things like medical marijuana because it helps them reduce the nausea, vomiting, loss of appetite, and tingling and numbness side effects from the chemo and radiation therapy. And we'll follow them along monthly or every other month as needed, depending on the case. And then annually they would follow back up with the neuro-oncologist to see where they're at with their tumor staging and if the tumor has grown again. And the last question is?
In your opinion, the reports of people using high amounts of CBD upon early diagnosis of cancer and the reduction of growth, is that not medically supported, or is that possible but there's just not enough studies to back that at this time?
I would say it's possible, but I don't have any data to support it. Usually what we'd like to have is a type of PET scan that looks at metabolism of tumors, generally speaking, so that if you take a PET scan before you start medical marijuana, look at the metabolism of the tumor, and you'll see a size imprint. And then 6 months after you initiate the medical marijuana at high doses and you do a PET scan, and if you see a substantial decrease in the metabolism and size of the tumor, then it is a reasonable assumption that the CBD alone worked. But for the most part, these patients are not treated with CBD alone or medical marijuana alone. They're usually treated with chemotherapy, radiation therapy, some forms of surgery, and have add-on therapies with CBD. So we really will never find out in those cases, did CBD work in isolation, or was CBD an adjunctive assistance, or was CBD irrelevant to the treatment? And that's the basic problem. So with that, I will sign off today this wonderful, vigorous discussion on brain tumors. I think we should probably continue it another day, because I think we have a good number of people with serious questions. I would like you to contemplate on the idea of not getting carried away with treatments that are not proven, because essentially it's important to get proven treatments first, and then if that fails, then of course all bets are off, and it's worthwhile going after other types of treatments, and it's worthwhile scouring the world through the internet to see if any other real worthwhile treatments are available. And that's it. Have a great night, and we'll talk again in a week or so.